Good morning, everyone. Welcome. Thank you for joining us for today's webinar. We're here to learn how to reduce call volume, improve care efficiencies, and prevent physician burnout. I'm your host, Scott Brady, and I'm a senior healthcare consultant for SE Healthcare with over 20 years of experience in process and quality improvement, organizational development, and project management in industries such as healthcare, chemical manufacturing, and also with the Department of Defense. Our goal for today is to have about 35 minutes of presentation, and at the end have about 10 minutes of Q&A. And I will encourage everyone to submit your questions at any time in the questions pane, and we will return to them at the end of the presentation. So without further ado, it is my great pleasure to introduce you to two of our keynote speakers today. The first is Stephanie Sargent, who is the Chief Clinical and Quality Officer for SE Healthcare. And Stephanie, by trade, is an RN with over 25 years of healthcare experience. She's also a Lean Six Sigma Black Belt, where she has focused her skills to improve quality outcomes and operational efficiencies in healthcare organizations. Most recently, she was the Patient Safety Program Manager at the Medical University South Carolina in Charleston. Next, Dr. Xiaoshu Kang, who is the CEO of Kangaroo Health. She's earned her PhD from Johns Hopkins and has been awarded numerous national and international awards for Best Healthcare Entrepreneur. Kangaroo Health was conceived through inspiration when a family member of Dr. Kang suffered insufficient post-acute care that led to a significant loss of motion. Thank you both for joining us. We're certainly thrilled to have you here and excited to learn more about these timely and relevant topics. With this, I'll pass it over to you, Stephanie.
Scott, thanks so much for the warm introductions, and good afternoon, everyone. Thanks so much for joining us today. As Scott mentioned, today we'll be discussing how SE Healthcare and Kangaroo Health can help your healthcare organization, and not just for patients, but for providers too. 2020 was perhaps the most disruptive year in healthcare in U.S. history. We know that before COVID, burnout was 42%, and then came COVID, and physicians and nurses, healthcare workers in general took on even more stressors as they were adapting to, inadequate PPE, caring for the dying families who couldn't understand, including, visitation restrictions and confusion about clinical guidelines. They were also having concerns about contracting the disease themselves and bringing it home to their families. Healthcare is a stressful occupation, even under normal circumstances. So our doctors and nurses who are already expected to be empathetic and compassionate were under additional extreme pressures and workloads, at times with limited resources. The latest data we have is that burnout post-COVID is as high as 71%. So a little bit about our partnership with Kangaroo Health. We know that the biggest contributor to burnout is workload, and these are all the activities that are associated not only with patient-facing, but non-patient-facing work, like emails, phone calls, EHR charting, filling out forms, pre-authorizations, meetings, looking for things, etc. So on average, providers spend only 27% of their day providing clinical face time with patients, and as much as half of their time working on EHR related work or desk work, administrative type tasks. So SE Healthcare partners with other companies whose mission is to directly impact these burdens. So Dr. Kang of Kangaroo Health will discuss also how a remote care monitoring platform not only lessens the burdens on physicians, but also for the patient. Next slide, please. A little bit about burnout. So let's put some descriptors around what it is and what it looks like. it's way more than having a bad day. Burnout is defined as the result of prolonged exposure to stressors on the job. So it manifests in any of a triad of symptoms. It can be exhaustion, so feelings of emotional depletion, feeling worn out, having low energy or fatigue. So this can be emotional or physical exhaustion. Cynicism, and this is a feeling of detachment from your patient. So you may feel less empathetic and feel less of the feeling that your patients are people, but that they are objects. And so it's kind of a removal of a feeling of attachment or empathy towards your patients. And then finally, feeling ineffective. And so this is a loss of sense of purpose in your work or meaning in your work. You may feel as if, what's the use type sentiment. And here's the thing about burnout. Burnout is portable. So that means it doesn't just impact you in your workplace setting, but it follows you wherever you go. So if you think about Pigpen and the dust cloud that surrounds him from the Peanuts cartoon, that's what burnout is like. It follows you around wherever you go. So you take it home to your family and your friends. But here's the thing about burnout. It can serve a highest and a best use, and that is that it can put a person on the path for seeking more purpose. It can be the impetus that puts them towards making a more fulfilling career for themselves. And we're there for that. This is SE Healthcare's expertise. Next slide, please. So the cost of burnout is tremendous, and many of these are hidden and not necessarily tied directly to burnout, but they are nonetheless the consequence of burnout. We know that medical errors in settings of high burnout are as much as 3 times higher, and the cost is severe. So not only does it impact the patient and they suffer through the consequences of a medical error, but there's money tied to that too, on average estimated at $15,000 per error. The clinician may suffer loss of reputation with his patients in the community or perhaps his peer. Burnout individuals tend to cut back their work hours or perhaps have higher absenteeism or might even exit their career entirely, seeking greener pastures, doing other things, but there's a loss of productivity. The turnover, so leaving the organization. It costs between $500,000 and $1 million to replace a physician in an organization. So that means recruiting, training, getting them up to full productivity. On average, turnover is about 6.2% in physicians, and so you can do the math on how expensive that can be to a healthcare organization. At its very worst, suicide among physicians is 2 times that the general population. So just choosing medicine as your career path doubles your risk for suicide. Next slide, please. I'd like to make a point about engagement. A lot of healthcare organizations measure engagement, and there's nothing wrong with that. That's a great measure. However, measurement is not the polar opposite of engagement is not the polar opposite of burnout, and let me explain why. So this is a great conceptual model of a study, a 2020 study that came out of Brazil, and it was looking at 2 things. It was looking to examine cortisol, which is a stress hormone, across different mental states. So what the mental states that they were looking at was engagement and then the tip over into burnout. So as cortisol rises, we see the higher demands of engagement, and then you're getting strained, but then we see the tipping point over into cynicism, as I was describing a second ago, and then further into burnout. So the point here is that your highly engaged employees are 20% are going to tip over into burnout. So be on the lookout for your rock star physicians and nurses, and these are folks who are highly motivated. They're engaged, responsible, accountable, they're proactive and go the extra mile. But 20% of these folks will tip over into burnout. Next slide, please. We're all familiar with the Kubler-Ross 5 stages of grief. But have you ever heard of the Zunin and Myers 6 phases of the human emotional response to disaster? So this is a very interesting theoretical model that represents the phases of emotional responses to major disasters. So some disasters can come with no warning, or some can happen fast, but most happen with a big bang, so to speak. So think of something like an earthquake or a tornado. And then after that impact, people work through predictable stages. And by the way, these are not pathological stages here. These are normal responses. But when you think about the COVID-19 pandemic, it's pretty easy to walk through these phases. There's the impact, the shock, the disbelief, the confusion that comes with think about that first spike in spring 2020 where COVID hit hardest in especially certain areas, New York City, for example. And then there's some recovery, and then there's a heroic stage where people are in their rescue mode, and there's expressions of strength and cooperation. Um, and then the honeymoon phase, and this is when we see a dramatic shift in emotion, and there's community bonding, there's some optimism that everything will return to normal quickly. There's opportunities at this point to connect with organizations, specifically connect with their providers to establish and build rapport in the way of providing them resources that they need. Then we see the tipping over into disillusionment. So when the honeymoon phases disappears, we see people realizing the limits of their disaster assistance. There can be negative reactions such as physical exhaustion, even tipping over into substance abuse. But the increasing gap between need and assistance in this part can lead to feelings of abandonment. So, the final phase is reconstruction. But the point here is that with COVID, it wasn't like COVID came and went. COVID seems to wax and wane and wax and wane, and we're still in the middle of it. So the point is that this is a really incredibly important opportunity for healthcare organizations to make sure that they position themselves to provide now for what your healthcare providers need, but even into the future, 12 to 18 months from now, because that's when we may begin to see, even at the far end, PTSD from those who were in the worst of the circumstances related to COVID. But it's a super interesting conceptual model, and I invite you to spend more time thinking about it and looking at it. All right, next slide, please. So SE Healthcare has been measuring burnout for many years, and realizing that we had a severe problem, we partnered with the expert in the United States on training and coaching for burnout prevention, Dr. Dyke Drummond. He's a family physician. He's out of the Seattle area. He's personally experienced burnout twice in his own career. And after the second episode, he decided, you know what, I'm going to be part of the solution. And so he got his coaching certification and really began a 10-year path towards on the ground training and coaching physicians. And then that expanded over into healthcare organizations as well. So to date, he's trained over 40,000 physicians and 175 corporate clients. He really is the authority, and partnering with him, we were able to convert his content, his training curriculum, into a scalable platform that we have implemented into, next slide please, into our program. The Enrichment Center is a web-based platform within our full burnout prevention platform that really helps complete your medical education, we call it, because we know that most clinicians were not trained or educated on burnout prevention within their training years. So we purposefully created the curriculum with this intent. So we provide some foundational concepts on burnout and what it is, pathophysiology, etc. But the other content is all about centering your practice to mitigate against the effects of burnout, and really developing a practice plan, a master plan to set you on the path of improving your career satisfaction. It all carries CME for physicians and contact hours for nurses. It is meant to be watched sequentially, but it doesn't have to be at all. So next slide, please. The Enrichment Center is one part of the program. I just want to say that Our program was built on the principles of continuous improvement, so it includes a measurement tool, which is foundational to understanding and monitoring your improvement. A dashboard, a web-based dashboard that provides a lean visual management tool to monitor, again, iteratively your path towards improving well-being for your clinicians. And then we have dual parallel strategies, one for the individual and then also for the organization, where we find insights for the organization to help improve and reduce the contributors, the system-based contributors to burnout. Has to be a dual parallel strategy because we know that as much as 80% of burnout is from working within a system that has flaws in terms of efficiency, et cetera. So we see Kangaroo Health and remote care monitoring as one of those parallel strategies for healthcare organizations to significantly reduce workload pressures on providers. So this includes reducing concerns for quality of care, improving clinical outcomes and efficiency, streamlining workflows, but also for the organization to leverage new technologies that increase revenue and alleviate the serious economic concerns that were and are still the repercussions of the pandemic. So with that, I pass it to you, Dr. Kong.
Thank you so much, Stephanie. So the pandemic, as Stephanie pointed out, really pushed the healthcare forward by 5 to 10 years. Now, most providers, if not all of them, are adopting telehealth. Remote patient monitor is different from telehealth, but it complements really well with it. So what is remote patient monitor? Remote patient monitor is to allow care providers, care teams to track patients' vitals, symptoms, patient reporting outcomes, and using connected home sensors and intelligent applications. But we know that all care teams are already overwhelmed. Instead of flooding them with more data, more information to look through, we use machine learning to automatically risk stratify these patient data, so that what that means is that we allow busy care teams, without making phone calls, playing phone tagging game with patients, quickly zoom into the patient at risk to allow more opportunities for early intervention and avoid adverse event. In addition, it really enables care teams to have a guard view on the patient changes, so that they can decide the best way to triage patients at scale. And next slide, please. Another thing is that for physicians, instead of just tracking patients by single disease types, we allow provider to understand patients' disease types and their comorbidities changes altogether using a whole person perspective. So that, for example, you may have 2 heart failure patients, one with COPD and diabetes, the other with hypertension, obesity. Those 2 patients, the care experience in this remote patient monitor program is going to be different. And it's automatically personalized based on the patient disease types and comorbidities. So we allow the care teams really have a whole person perspective, understanding what's the best way to give patients treatment accordingly. So next slide, please. So how do you enroll a patient into the program, get patients started? It's actually very easy. Once you decide which patients to enroll, then the patient will be added into the platforms, and then the patient will get automatic text message. And then the nurses or care coordinator, anyway, it doesn't need to be the healthcare professional, it could be the front desk, will help patients download the application and get patients started. The sensor patient can pick them up from the clinics, or we can ship the sensor directly to the patient's home. Now the patients with the connected device at home with the intelligent applications, we're able to put like a virtual care nurse into the patient side, at the patient side every day. And it's automated. So it really enables your care teams in a low touch way to reach, retain, and engage all your patients at scale. From the caregiver's perspective, now they can have a whole dashboard, HIPAA compliant dashboard, to look through which patient are at risk, with high risk, which patients are doing well, so they can decide like their patient, like inter-patient triage activities. And also on the other hand, it really enable double or triple the care capacity managed by each care staff. Because now they don't need to do the phone tagging games with patients. They have more time to focus on those patients who really need their care. Next slide, please. This is a randomized the controlled study clinical trial has showed that remote patient monitor actually improved patient outcomes. And this specific patient population is heart failure patient population. And from the year-long study, they showed that really reduced patient readmission days and improved patient overall outcomes. The reason they pick heart failure is because this is one of the highest risk patient populations. Next slide, please. From the patient experience, now the patients for the first time get additional care between the patient visit. That's the beauty of the programs, that when you adopt remote patient monitor, clinicians don't need to cut back on office visits, on telehealth visits, on changing your clinical flow. You can imagine this is a layer put on top of the patient care activity you're doing. But at the same time, it converts all your care activities into a reimbursement channel and also automatically documented into the system. On the patient side, now the patients can get timely triage, additional care education and support and coaching, automatic pre-programmed from the programs. From our studies, it showed that really improved patient adherence in terms of your treatment prescriptions and recommendations, and also improve patient outcomes, elevate their psychological well-being as well. Next slide, please. So for caregivers, what it does is that it really streamline the workflows. So think about it, you may be doing a lot of redundant work for your patients in terms of giving patients repeated educations material to every single patient. You made some clinical protocols that you need to emphasize to every single patient. Now with adoption of remote patient monitor platforms, we can convert your clinical protocols and your educational content configured into the programs, so that the programs does the education, does the patient engagement for you at scale in a low touch way, so that allow patients to easily digest the piecemeal information every single day, and they have better patient retention and better patient engagement. At the same time, really streamline your workflow and enable care team to be more focused on the patient care in the clinical settings. Next slide, please. As I indicated, this is actually a reimbursable program. So this is something that, in addition to all your existing care activities, there's a separate set of reimbursement code. And it converts all your care activities between the visits into reimbursable units. And it adds at least $100,000 per physician per year. And what it does is that really pays for the technology and pays for the clinical care at a time to enable you to triage patients and engage patients really effectively, and understand the patients, which patient to triage in a timely manner. As Stephanie pointed out earlier, it reduced call volume significantly, and it also improved the per patient care panel managed by each care staff, and also enable you to improve patient clinical outcomes at the same time. Next slide, please. So you may be asking, like, how do we get patients started into the programs? The first thing is that we do is to configure the platform based on your clinical protocols and your educational protocols, because we deeply understand each provider, each care organizations may be different. So we don't want to play doctor role here. Instead, we follow your protocols, enable you to triage your patient most effectively. Secondly, we will teach your care teams and your enrollment teams to how to enroll the patients in the office and how to monitor and coach patients remotely using the systems. It's very easy, and most providers get to learn it within 30 minutes. Last but not least, the system's beauty is that it automatically documents all the care activities. For example, you chat with the patients for 5 minutes in the system, or your nurses review patient profile for 2 minutes. So we document all of those automatically, alleviating all the overhead for documentation, so your care teams can really focusing on the remote patient monitor and patient coaching. Next slide, please. At the end of each month, we will provide automatically a reimbursement report that's enable you to go through your normal current reimbursement channel to get proper reimbursement. The reimbursement is per patient per month on a recurring basis. So with this generous reimbursement, what the CMS and other commercial payers are hoping to gain is to improve the patient experience, reduce patient readmission, reduce unnecessary utilization of the care patients, and really improve the patient overall outcomes and adherence to treatment prescriptions. So that's a remote patient monitor on a 50,000 feet level overview. And if you want to learn more, please feel free to contact us at hello@kangaroohouse.com. So if you have questions, please feel free to put it in your question box. With that, I will pass it back to Scott. Thanks, Scott.
Thank you, Dr. Kong. That was very insightful. I was really impressed with some of the things that I heard out there. I don't know how the audience felt. But for Stephanie, the graph of the human emotional responses by Zunin and Myers, I'd never seen that before, but it makes a whole lot of sense. I know a lot of people have been on that spectrum at one point or another, but that's very interesting to be able to tie it to potentially understanding what future things are coming, specifically for COVID. And also another thing that I noticed with Dr. Kong, when you were talking about the program, I think it's incredible that providers can get an additional $100,000 in revenue just from the reimbursements. And I understand there's some new CMS requirements that are available for folks, and I think a lot of people aren't necessarily taking advantage of that. So certainly very, very appreciative of bringing those things to light. One of the things that I see as far as the two companies, SE Healthcare and Kangaroo Health, I think with our current challenges that we're seeing now out there in the healthcare systems, I think both programs, as you both had mentioned, I think address the root causes of adversity. And what I mean by that is they help to kind of streamline processes with fewer care team members when we've all seen a shortage of care team members out there, nationwide nursing shortages and provider shortages. But in addition to that, increasing the revenue and efficiency for those organizations. And I think ultimately by doing so, we're addressing the clinician burnout at the source. Ultimately, and I think that's leading to a more healthier, happier environment for everyone. So I hope you got a lot out of the webinar, and we are now actually at a point where I'd love to take some questions. So if you have any questions, please feel free to add them to the questions pane. And actually, I have a first question I'd like to ask both Dr. Kong and Stephanie. The first question is, my organization wants to build a wellness program for their clinicians. How would the burnout prevention program fit into that?
That's a great question. And what we find is that organizations are all on some pathway towards doing exactly that. And some are more mature than others and have more infrastructure in place, a little bit more maturity, and some are just starting that. And what we do is we meet you where you are, and excuse me. Further, our burnout prevention program is a fantastic foundation. So it can be either an adjunct to what you already have in place, or if you're just beginning to build a wellness program, what we have is the foundation. So Lean Six Sigma and continuous improvement is founded in measurement and visual management, and constantly measuring the voice of the customer and understanding where you can reduce workload burdens and administrative type tasks, and then improving on them incrementally over time. And that is our program in a nutshell, along with providing individual resources to clinicians to help them manage their personal stressors. Again, it's a dual strategy where we give resources to clinicians and we give the resources to the organization. So we provide the foundation for a wellness program, or we can fit into what you already have, but nonetheless, it's a great addition to whatever you have. We meet you where you are. Thanks, Scott. That was a great question.
Yeah, great answer. Great answer. Thank you. Got another question that came through. Someone wants to know, Dr. Kong, I think this is for you. They were asking, as far as the RPM program, that who handles the eligibility and prior authorization for each of the patients that these providers may be seeing. If a provider sees that a patient may be available or maybe a good candidate for RPM, who handles that eligibility and prior authorization for that patient?
Yeah, that's a great question. So for the eligibility and prior authorization, for like Medicare patients, where Medicare Advantage, there's no need for eligibility check because this is something that CMS already reimbursed. For the commercial plans, many commercial plans are covering that, and some may require prior authorization. And there are two ways to do it. Kingra House can do it on behalf of the provider for the patients in batches. Or if the provider wants to utilize their existing PA prior authorization team, eligibility team, they can do that too. So we do give provider options based on their clinical flow.
Great answer, great answer. Oh, and it looks like there's a follow-up question as well. I know a lot of areas, there's always a concern of people not having the proper technology to be able to take advantage of RPM programs like that. So one of the questions really came from an audience member. What if a patient doesn't have a smartphone? Because they were saying that some of their patient population may not necessarily have access to a smartphone.
Yeah, that's definitely a great question. And for those patients, we have basically, we will give patients a tablet with our application built into the tablet. And so that patients can take the tablet along with the other connected home sensors home. And so the tablet will serve as a data hub connecting automatically with the different sensors patients brought home. And so that a provider can remotely track patients from there. So we do consider, especially for very senior patients, when they just have like landline, we can give them this tablet for them to use easily at home.
Wow, that's wonderful. Great answer. Another question that came through, one audience member is very interesting in comparison with the Burnout program. I think a lot of companies are always looking at, where are we listed as far as national benchmarks and how we're doing against other organizations. And so this question, I think, is for Stephanie, specifically to the Burnout question, is how do we compare yourselves against other organizations or other national benchmarks out there in terms of burnout severity?
Yeah, so we've been measuring burnout since 2016, and our client base is coast to coast. So that said, we do have national benchmarking. We also measure against medical specialty, gender, and age group. Excuse me, I was blanking on the third. So we're able to easily provide that benchmarking for both the individual and the organization. And, it's interesting, we find that, physicians and nurses, they really want to be compared against their peer group. Very specifically, physicians want to be compared to their medical specialty. So we do offer that. We also find that individuals who are seeing this for the first time, when they're looking at themselves benchmarked against their peers, that sometimes they're actually seeing for the first time where they are in that burnout continuum, and it can be a real eye opener, and it can really, that alone can be the impetus for them to make a change. And the last thing that I want to say is that it is important, that benchmarking question is incredibly important, because the filterability within our dashboard does offer a way to look at the data in a way that makes it actionable. If data is too generalized, then it's very difficult to make pinpointed efforts and understand where you truly have opportunity. So our dashboard does provide that as well. That was a great question.
Okay, wonderful. Well, certainly great answers, and we really appreciate your time, Dr. Kong, Stephanie. Were there any other questions out there in the audience? Any attendees that have any final questions before we close? All right. If not, we'll go ahead and begin to close. Stephanie, Dr. Kong, thank you again for your expertise, your time. We really appreciate everything that you've provided to us, and looks like the end of our time is near, and we've covered all the questions. For the attendees that are listening, just let you know, you will receive an email follow-up with a link to this PowerPoint and also other resources that are on our website. So there's going to be more information on our website and also on our YouTube channel. I invite you to check those out. We do have additional videos and webinars that are on the YouTube channel for your reference. And please feel free to reach out to Stephanie or Dr. Kong if you have any kind of specific questions for them. Their contact information is there. And thank you again for joining. Take care, and we'll see you next time.
Thank you, everyone.